Good morning, everybody. This is Dr. Jeff Culbert, Schooley's Mountain Chiropractic Center, and believe it or not, for all you guys that clamor, where's the adjusting videos, Doc? I've got Jerry in the practice. We literally just finished an interview with Jerry. It's a little bit of a long video. It's 32 minutes. Great interview. A lot of super information going out on that video, so please, when that one comes out, make sure you tune into that video and try to watch the entire video, because interviewing Jerry, just like when we did Josh a couple of weeks ago, absolutely phenomenal interview, great interaction, great energy, and a lot of useful information that maybe opens up your eyes and your doors to what chiropractic is, can be, and should be for most people when they come into a practice, and how we make it not only a treatment in the practice, but also a lifestyle that you can adopt and accommodate to. Believe it or not, Jerry, as we mentioned in the interview video, found us on YouTube when we were doing the review of the Hume scale. And I got to tell you, the Hume scale opened up the doors for a lot of controversy. Some of you guys absolutely hate it. Some of you guys absolutely love it. Fortunately, it resonated with Jerry, and he noticed that Schooley's Mountain Chiropractic Center, not too far from home. And then he had a conversation with his daughter, a friend of his daughter, who has actually worked in our office. So talk about being separated by 6 degrees of separation, and it's a small world. I referred him in, and he came in. He has been on a life journey, transitioning his life from being relatively inactive to being very, very active with working out. He's a personal trainer as well as his normal job. Does Brazilian Jiu Jitsu, which, as he describes in our video, is like somebody, it's aerobic-based activity where somebody's literally trying to choke you, okay, to get you to tap out. So he's come in with a number of different challenges and problems to his spine and to his upper extremities and his legs. So we're going to just go through, as we always do, a normal adjusting process here in the office. Right now, Jerry is underneath relief care. And as we like to describe, relief care is that care which is basically situated just to make you comfortable. Okay, you know, we try to reduce your symptoms by 50 to 100%. Typically with most people, we're looking at anywhere, depending on the stage of their life, the degree of severity of the condition, the chronicity of the condition, could be as little as 2 to 4 weeks to maybe as long as 6 to 8 weeks to put the fire out, and then start the transition process if that's something you would like to do, from relief care to corrective care, and ultimately to supportive or wellness oriented type of care. So without any further ado, Jerry, wave hello to everybody, and we are going to get started doing what we typically do. And as always, if you've watched our videos, we always start off with looking at leg lengths. And Jerry was away for most of last week, and he came in last night, got adjusted, was gracious enough to come down to do an interview and another adjusting video with us. So we might not find a ton of stuff off with Jerry today, but we're starting off with a little bit of a left short leg. So hold up, Jerry. So again, as we normally find with a short leg, there's going to be a pelvic fault that is there. So Jerry's left SI joint is a little bit off. So we use 6 different techniques in the practice. We're going to start off with SOT blocking for that pelvis for a category 2. Just do some gentle pressure to start to shift the pelvis. I also incorporate a lot of techniques that you've seen in previous videos, so from AK to activator, diversified adjusting, flexion distractions, cranial sacral work will get done, extremity adjusting gets done. A lot of stuff happens in a rather short period of time here at Schooley's Mountain Chiropractic Center. We do take a whole body approach. I will not just address a single issue in the office. So if somebody comes in with lower back pain or neck pain, hip pain or knee pain, we are always going to be looking at what are the different linkage points and things that can influence what's going on. So if Jerry's pelvis is off, I'm going to be checking hip, knee, ankle, and feet. The lower back and pelvis is going to influence what goes on up in the neck and the cranial region, the upper back with the lower middle back. We run the gamut of things that we're going to end up doing and checking on a per visit basis. Now, one of the things that is showing up weak there with Jerry, this is a point here that doubles its stress or its sinus. So acupuncture points over the adrenal glands say maybe more stress than sinus. Right, Jerry?
Of course.
So, again, we find something that's weak, we are going to go and work that area with a little acupressure, gentle massage. We will opt to use the activator on some of these points. And what we're doing basically is when we find a weakness, we are going to work certain points on the body, which I like to call switches. And as we work these switches, we are going to try to influence the body to then take something that is weak and make it strong. Everybody's very familiar with what goes on with facilitatory reflexes, like when the doctor takes a reflex hammer and hits a tendon and your arm jerks or your leg jerks. Inhibitory reflexes are fired by Golgi tendon organs, and those are the inhibitory endings to the nervous system. So right now, if I've stimulated correctly for the stress receptors, Jerry will end up testing strong. Now I'm going to also come back down and check the adrenal glands. And just by influencing one set of stress receptors, Jerry's now turned on the switch for 2 points with one shot. So killing the proverbial 2 birds with 1 stone. And again, not too much pressure in the neck. Again, those arms were dropping a little bit more frequently last night. So we're just going to fine tune a little bit here. And again, Jerry's just going to relax for me. There we go. And again, a little bit of a, there we go. Super. And we're going to bring the arm out to the side. You're going to hold the arm up. I'm pushing down. Good. Shoulders holding. Come across the other area. And hold. I'm pushing down. Great. Super. Checking the muscles for the hip. Leg stays straight though, Jer. Hold. I'm pushing down. You're holding up. Okay, so we've got a little bit of a hip flexor that's a little bit off. That's the psoas muscle. Hold. I'm pushing down. So we're just going to fine-tune the psoas muscle on the right a little bit. And for everybody out there who may or may not know, the psoas muscle, if you're into Ayurvedic medicine, Chinese acupuncture, psoas muscle is our key primary muscle for the body. It is also the muscle that tends to be off the most. It is also our bend and twist muscle, our lift the leg muscle, which I'm sure in Brazilian Jiu Jitsu, you get a little bit of work and use on that. The other thing is that for everybody out there to realize that also the psoas muscle sits on the kidney acupuncture system, just as the upper traps do. So it is generally when we find that there, I just always want to reiterate to everybody that you should be drinking plenty of water. It's the main nutrient for the psoas muscle, kidney-related points. It also flushes your immune system and your toxins, helps with digestion, makes sure your joints are lubricated, the muscles are well fed and full of fluid so that they're working well. And if your body is 70% water, and I make a lot of reference to the good Lord, if water was the first thing he made, I think you should consume the first drink that he made. There we go. And hold leg up for me, I'm pushing down. Great, significantly stronger. And we're going to take the blocks away. Good. And hold here, Jer. Good. Good. Super. Just going to be one little tweak on that left side. So if I can have you lay on this side for me. Bottom leg stays straight. There we go. There we go. And you, my friend, are going to let the shoulder relax back and breathe in and breathe all the way out. There you go. Thank you. Now, Jerry came in with a slightly shorter left leg in position 1. That looks really great, but if you'll notice, position 2, we've got a little bit of an imbalance right across the small of the back. So we are going to do a little flexion distraction and stretch that area out. And for most people, this feels very comfortable. And this is just opening up the facet joints, the lower disc area in the back. And if he's drinking enough water, little by little, that disc will start to rehydrate over time. There we go. And then we just do a little counter pressure to relax those little tight muscles in there. And I'm sure you can feel that start to relax right about now, right?
Absolutely.
There we go. Excellent. Great. And again, we're just going to come back and check. Bend the legs for position 2, and now we got perfectly even feet. So that is beautiful. Now I'm just going to do some pressure testing, different areas of the middle back. And again, this is part of some of the stuff that Activator allows us to do. Activator can go through a series of arm positioning to stress different levels of the spine, or I can do breathe in, Jer, all the way out. Good. I can simply do a little pressure test. And if I pressure test into subluxation, the legs will shorten up, just as the muscle will shorten up or weaken when I'm doing a test using the muscles as indicators. And again, breathe in, all the way out. There you go. And Jerry was telling me the area of the spine that we just adjusted with Jerry tends to be very common where somebody is dealing with a lot of stress, stomach issues, or they slouch. Obviously, Jerry's got impeccable posture. He works out consistently. Some of the things that goes on with work can be rather stressful, right, Jerry?
Just a little bit.
Okay. So with the crazy amount of stress that we carry in the world, whether it's emotional, physical, or biochemical, it is not uncommon to see that T6 area of the middle back show up pretty consistently with people. The other thing is that T6, T8 area tends to be more of the center point for the spine, and unfortunately what happens at the neck and what happens down at the pelvis is much like a rag, and if you ever took a rag and started to twist it at the ends, it always knots up in the middle. So when you've got a lot of stuff going up top and bottom, a lot of times this middle area will start to knot up. So some of it is just secondary compensation, and then the other part is how much of it is stress and tension and worry. Small vertebra in the neck, we affectionately call that the tired bone. Typically use the Activator for that. There's a technique out there you guys may have seen, that Y strap or that towel yank and pull. Not a particular move that I like to do. So I use the Activator, small handheld adjusting tool. Very, very, very effective because what it lacks in oomph, it makes up for in speed. And the speed of the adjustment typically is what works better than the force of the adjustment. Go. Now the last thing we're going to do with Jerry is, because what I affectionately known as the tired bone was a little bit out, I'm just going to give a little gentle traction to the neck just to stretch and open up that area. And again, just like stretching the lower back, it should feel fairly comfortable. Should not be anything that yanks too hard or too fast. A gentle rhythmic motion just to separate out the facet joints a little bit and just take a little bit of pressure off. And again, Jer, how's that feel?
Feeling pretty good.
Excellent. And then the last thing we're going to do, because the stress was a little high, we're going to leave that traction down a little bit. We're just going to work the upper trap a smidge, and then we're going to give a little counter pressure to the base of the skull. And again, Jerry, you should be feeling those muscles starting to relax right about now.
Feels wonderful, actually.
Okay, the best way I can describe it to most people, it's like you've got your thumb in butter and the butter starts to melt. Now, you're fortunate, Jerry, I haven't gone into when your leg is short that you got one leg should be in the furrow. Although we live in a rather farming community, so most people tend to remember what the furrow is. There we go. And that's starting to relax. Perfect. Feel great?
Yes.
Excellent. So everybody, this is Jerry, and we just gave a typical adjustment for most of our patients that are coming in during the relief phase of care. I think you can see a lot gets done in a rather short period of time here at Schooley's Mountain Chiropractic Center. We do take a look, while Jerry has some neck and shoulder and back and hip issues, we take a look at the whole body. We're checking acupressure points over the intestines. We're checking immune system points. We're checking cranial points, double checking shoulders, the muscles that go in and around the hip. And again, if you can see us how we're evaluating, it starts at the bottom of the feet and literally ends with the top of the head. So it is a complete holistic type of adjustment that you get in our practice. There are docs out there that just take care of areas of complaints, and if that resonates with you as opposed to a whole body approach, then good luck finding the right person. If you're looking for something that's different and we've given you something to think about, please visit smcc4u.com. And if you've seen something that you've liked here, please hit the like, the share, the little bell for reminders when we put out new videos, and please share with family and friends, because if you look at the video that Jerry and I had done, please, we spoke about a revolution where more people see medical doctors than maybe statistically they should, based on a study that says 50% of people have disease and infirmity because of how they think, 35% because of biomechanical faults, and only 15% of disease and infirmity is truly medically oriented. So we would love to see those numbers instead of 85% of the people run into a medical doctor when they should be seeing mental health specialist, chiropractor, physical therapist, massage therapist, acupuncturist. Start the shifting that to the 85% the other way versus the medically oriented route, and trust me, I come from a medically oriented family. Dad was an MD, mom was an RN, my brother's an MD, my sister's a vet, I'm a chiropractor, my daughter is a DO. We're very medically oriented. Trust me, when medicine is needed, go that route. But before medicine and surgery are needed, always think wellness-oriented alternative care, whether it's mental health, chiropractic, physical therapy, occupational therapy, acupuncturist, massage therapist. We're trying to create the wellness revolution that will make America healthy again. So this is Dr. Jeff Culbert signing off from Schooley's Mountain Chiropractic Center. Jerry, thank you so much for your help today. Really appreciate you, brother. And we will see you in another video real soon. You guys have a great day.